Next, we have Taboris Fisher with OralID, a division of Forward Science.
Good morning, everyone. My name is Taboris Fisher, and I am here representing Forward Sciences. Today, I'll be talking about a product for dry mouth, Saliva Max. Saliva Max is indicated for hyposalivation, xerostomia, and mucositis. For your patients that you see, if you're seeing patients prior to beginning head and neck radiation therapy, then Saliva Max is a very viable option. As you know, as these patients go through their initial consult, it kind of it doesn't hit them into post-treatment that, hey, the doctor did mention something about not being able to produce saliva. And as great as oncologists are at what they do in regards to the mucositis process, they're very reactive instead of being proactive. So they'll let a patient go through, begin treatment, and then that patient experiences the mucositis, and then at some point they have to stop because they can't continue to go through treatment because they can't eat or drink because the infections are so bad. And so with Saliva Max, if you're seeing patients that prior to beginning head and neck radiation treatment they're going to begin treatment, Saliva Max is a very viable option to begin that patient on in day one before they even begin treatment. In regards to patients that suffer from xerostomia or hyposalivation due to medically induced xerostomia, you have patients that come in. They may be polypharmacy patients. They're on 4 or 5 different medications. There's at least 400 or 500 medications that cause dry mouth as a side effect. So it's a lot of times it's take your pick when you see these patients as far as what is causing the dry mouth. So Saliva Max is indicated for hyposalivation and xerostomia in those patients as well. It's a very viable option. And then again, your hyposalivation from pre and post surgery, radiation therapy and chemotherapy. A lot of times what we found when working on the MD side is, again, they're great at what they do, but sometimes if you've never experienced dry mouth or had someone in your family that has experienced dry mouth, you may not necessarily understand. So a lot of times when we call on doctors on the MD side, a lot of times they'll just tell us point blank, hey, I saved the patient's life, they're alive, it's just dry mouth, deal with it. And that's what we hear from doctors sometimes. They tell them to drink sweet tea, they tell them to suck on candy, they tell them to just drink water. That should take care of the problem. But you very well know when that patient walks in your door, there is a problem, there is an issue, and it is one that they're looking to you for answers. So what is Saliva Max? Saliva Max is a supersaturated calcium phosphate rinse. When mixed with water, it forms a highly concentrated electrolyte solution that mirror the natural components, the inorganic components of natural saliva. So those components being sodium chloride, calcium phosphate, and bicarbonate. That being said, what sodium chloride does, it cleanses. But the bicarbonate, the calcium and phosphate, I like to talk about those and just hit on those very briefly. Bicarbonate, as you know, it diffuses into the plaque biofilm, acts as a buffering agent, and neutralizes the acid. Well, when you start talking about neutralizing acid, then you begin to talk about pH. What we found in the toughest of the tough patient that is a post-treatment head and neck radiation patient, that if you get the pH back into balance, those symptoms are reduced tremendously. So when you start talking about pH, again, think of a swimming pool. If the water in the swimming pool is not balanced. The pH isn't balanced. The water begins to turn green. The bacteria is allowed to colonize, and therefore you see a change in the environment. With the oral cavity being no different, if the pH isn't balanced, what you're going to find is that bacteria is being allowed to colonize. Those patients come in, they have a ton of root and buccal caries, and it's because that bacteria is being allowed to colonize. Therefore, pH levels, if they aren't where they need to be, calcium phosphate levels aren't where they need to be. Therefore, when you start talking about remineralization occurring properly, if the pH isn't at 7.0 in that range, then remineralization isn't occurring properly in these patients either. And so you may have a patient that comes into you, you just saw them 6 months ago, you know that it's not an issue of them not coming in regularly for their checkup or their visits, but yet they come to you and they have all these caries and you can't figure out why. And one of the first things you may want to do as an option is give them a fluoride treatment. Well, if calcium phosphate isn't where it needs to be, then what you're going to find is that fluoride is ineffective because you don't have the patient doesn't have the proper amount of calcium phosphate in their saliva to really make a difference. So again, sodium chloride, bicarbonate, and then again calcium phosphate. Those are the components of Nutrisal. In regards to the way it works, it's a swish and spit. So a patient would rinse with half of it for 1 minute, then they would rinse with the other half for a minute, and then they would not eat or drink for 15 minutes afterwards, so it can really saturate the tissue and really be there for that patient. Saliva Max, in regards to how many times a day it's used, patients that have medically induced xerostomia, they'll use it typically about 2 times a day. Patients that have Sjogren's and other autoimmune diseases, they'll use it maybe twice a day as well. Patients that are beginning head and neck radiation treatment, you want to be very aggressive with those patients because you know they're going to be immunocompromised, and you're really trying to be aggressive and keep them clean so that they don't experience the mucositis. And so initially they'll rinse at least 6 times a day. Post-treatment, they'll back it down as they need it. So they'll begin to rinse maybe 4, 3, 2 times a day until they feel comfortable. Saliva Max is a prescription rinse. The way it works is if a patient has commercial insurance, then we help and we take care of the copay for that patient. So the way it works is the same card that the patient uses when they go to Walgreens or CVS, what you would do is just get a copy of that card and fax it in with one of our script pads. We ship directly to the patient's front door. They never have to step foot in the pharmacy at all, and it's delivered to their home within 2 to 3 business days. For those patients that you see that they're cash paying patients, maybe they just have no insurance whatsoever, the one thing about Saliva Max is that every patient will receive the product regardless of whether their insurance covers it or not. And what we have is a patient assistant program, so therefore if a patient if their insurance does not cover the product, then we allow them to receive the product through our patient assistant program. We are at booth 855, so please come by if you have any questions to talk more in depth about the product. We'd love for you to come by. Thank you all so much for your time.